All right, cool. Let's see what happens. Oh, whoops. I forgot to do that part. That worked. Are you guys there?
Yep.
Yes.
All right.
I'm
Hello,
giving our
everyone.
first comment too.
Oh, we did already?
Did?
Yeah, baby. All right.
All right.
So let's do this thing. All right. So we may be by ourselves a little bit tonight, but we're going to do a cool presentation. Oh, I got 6 eyes on this bad boy right now. So cool. That's kind of cool. So hopefully we're trying some new stuff, ladies and gentlemen. So I got this way. So hopefully we will see all your comments as you go. So anytime, if you want to type a message, go ahead. We're not exactly, oops, I didn't know what I'm doing there. Okay, I didn't need that. Okay, so we're learning. It's got to be this way. It has to be that we suck at it at first. That's how it goes. So tonight, we are going to talk about carpal tunnel, which I'm really pumped about, actually. With this new software, it's making it a little easier for us to kind of walk through what we want. And we promise we're not going to keep you here all night. So without further ado, we're going to start with a video that I want you to watch on the basics of carpal tunnel, what's going on in that wrist. This is a medical doctor that's kind of walking you through. Okay. So it's about 7 minutes long. So it's not too bad. So let me get it pulled up here. All right.
Makes the symptoms go away for a period of time.
Oh. Okay. And now I'm going to screen share. And here we go.
Greg Chappell at Intuit Medical, and today I'd like to talk a little bit about carpal tunnel. Somebody you know probably has carpal tunnel. If you don't have it yourself, 12 million Americans have carpal tunnel syndrome every year, and there's a lot of misconceptions about what carpal tunnel syndrome is and what carpal tunnel syndrome is not. For instance, if you treat your neck in some form or fashion or by adjustment and your carpal tunnel symptoms get better, you probably didn't have carpal tunnel syndrome. So let me go through some anatomy and teach you what carpal tunnel syndrome is, or at least demonstrate some of these facts to you. This is ultrasound. I use ultrasound for diagnostics and therapeutic purposes. But the first thing I'd like to demonstrate here is with ultrasound is we can now evaluate the median nerve. In this case, you see it on the screen. We call this a honeycomb appearance. You see lots of black dots in the median nerve, and below it, the structures, if you wiggle your fingers for us, are the tendons that go to the fingers. So that's a pretty cool shot of what we can see. If I scan down a little bit further towards the fingers, I'll begin to see this shadow, this arch that goes over the top. That arch inserts over here on this bone called the pisiform. There's the ulnar artery there, and I follow that arch back up over the other side, and it inserts on another bone in the wrist called the scaphoid. This forms the entrance to the carpal tunnel. So I have bones below, a ligament above, and it's encapsulated or encircled by this connective tissue, and that's what forms the tunnel, hence carpal tunnel syndrome. So what happens in carpal tunnel syndrome is there's no space to move. The ligament's pretty tight, the bones aren't going to move, and the softest structure in this tunnel is the median nerve. When the median nerve becomes compressed, it gets angry and sick and it swells. There's already not extra space in the tunnel, so if the nerve gets bigger, it's kind of a downward spiral. But that's how carpal tunnel syndrome basically occurs. Symptoms usually include numbness in the hand, but specifically the thumb, the second finger, the middle finger, and the ring finger. Usually half of the ring finger is affected. If it's been going on a long time, you can get weakness or wasting of this muscle in your thumb called the thenar muscle. So those are things to watch for. Usually, in most people with symptomatic carpal tunnel symptoms, they'll wake up at night with their hands numb or painful, and it requires them to shake them to wake them back up or to get the pain to go away. That's very, very common with carpal tunnel syndrome. Carpal tunnel syndrome, because it does affect a nerve, can radiate up the arm, into the shoulder, or even into the neck, but can't be treated from anywhere but the carpal tunnel if it's carpal tunnel syndrome. So now I'd like to talk about a little bit of treatment options. If your symptoms are mild, you can wear night splints. Those work pretty well. You can participate in physical therapy. That works very well. And that generally helps or resolves some of the symptoms. If the symptoms persist, then we may need to discuss surgery or surgical options if it comes to that. Prior to surgery, you could try a corticosteroid injection, which would also be helpful. Sometimes makes the symptoms go away for a period of time, and sometimes doesn't work too well at all. If the corticosteroid injection does help, that's a good indication that maybe surgery would be a good treatment option for you. As far as establishing the diagnosis of carpal tunnel syndrome, patient history or symptoms are very, very good for that. Another way is something called a nerve conduction study, in which we measure how fast the electricity moves down the nerve and how healthy the nerve is, which has been the most common test. Now, using ultrasound, we can measure the area of the nerve, and generally an area bigger than 10 millimeters squared would indicate you have a good chance of having carpal tunnel syndrome. In the presence of a large nerve and symptoms, it's just as good as a nerve conduction study. And so we can avoid now, with imaging and history, we can avoid sometimes painful or irritative nerve conduction studies. So as far as treatment is concerned with carpal tunnel syndrome, the standard of treatment has been what's been referred to as a mini open procedure. A mini open procedure basically has been used for many, many years and works very, very well. Incises the skin overlying the transverse carpal ligament, which we talked about earlier, the top of the roof. And if I draw a mark here, the incision is generally about 2 centimeters long. So that's an example of what happens today. The problem with this procedure, it works very well, is that you have to dissect and cut or interrupt a lot of tissue in order to get to your target. So there's another procedure that's been done very well at the same time called the endoscopic release, in which this incision is about half the size of the mini open and is performed in this manner, and an endoscope is inserted up under the transverse carpal ligament and it's also cut. It also works very well, and it heals a little bit faster than the open procedure, both of which work very, very well. Now, there's a micro-invasive way to perform the procedure. This requires a 4 millimeter incision, which is about that long, so half or less than half of what the endoscopic release is, hence a quicker healing time. So the problem with the carpal tunnel release is the healing time. Nobody can take 4 weeks off work, which can happen with the open release, a couple weeks off work with the endoscopic release, and now my average is about 4 days off a week with the micro-invasive release. The micro-invasive release is performed with this device by Sonex. We make the small incision on the wrist, all done with local anesthetic, insert the device, and then work it up underneath the transverse carpal ligament with imaging or ultrasound. So everything is done visualized, so the risks may be a little bit lower than with the open procedures. The healing time is much quicker, and like I say, most of our patients are back to work in 4 days. And a little bit of a demo how this works. The small device is inserted through the skin, and I'll take the roof of this carpal tunnel off, and we slide the device up next to the nerve, which is demonstrated here in yellow, and underneath the ligament, which is our goal. That's the only thing we really want to cut during this procedure. This device is kind of cool in that it's equipped with these balloons that blow up on either side of the device, pushing the nerve and the other structures we don't want to hit out of the way. After the balloons are deployed, I can see the structures that I want to hit and don't want to hit in imaging, so I don't have to dissect down onto them. And then a little blade pops up and cuts the transverse carpal ligament. I deflate the balloons, and we're done. The whole procedure generally takes anywhere from 6 to 8 minutes to perform. So and as far as healing, like I said, there's very little downtime. There's no splinting or casting afterwards.
So all right, this is a graphic example of why I like working on the outside of the body.
Yes.
I mean, there was no blood there, but I still am this like big old thing going
You're taking
up.
the scary chiropractor. I'm going, okay, so how did it turn? The video was okay? It didn't have too much double. Okay, good.
There's a little echo to it, but it was good.
Okay. I think that's my microphone. I think I figured that out. So he does a really good job of breaking down, I would say, the medical part. What do you think he's so when you look at it through a holistic approach, you have different mindset going in, right? So as our office will tell you, like, we are thinking slightly different, right? So my immediate thing was like, he did an excellent job of breaking down basically the medical options that are there, right? But he doesn't really tell you one little key aspect. Why does your median nerve swell? You know, we say, okay, this ligament gets injured or mad, and then we go up and procedure it. And then there's a couple little things that I will talk about as we go. And one reason I have these Lego blocks up and behind you, it's kind of cool. I got this, like, I was so excited to find this. My Lego wall with different Legos, and we'll talk about that in a minute. But one of the biggest things is, as you're going, like, so you have this procedure, right? And it seems pretty quick. Like, they get to that end goal of carpal tunnel surgery pretty quickly, right? So for us chiropractors, we look at something different. We always think the body is innately able to self-heal, right? So we have this innate ability to do that. So there's something causing that median nerve to swell or inflame. So where do we look first, right? So that's where I'm at, where I'm looking at that going, we're missing a few steps there prior to, you know, us going into cortisone injection and then putting a scary big old needle up in there that us chiropractors don't want to do. So,
well, and I think, and I like what you're saying, missing a few steps, because I think it actually is fair to go back a few steps. And I also want to tell you that I giggled because when Amy took a sip of her water, it looked like she was drinking from a Pringles container. And that was kind of fun to me, that she was like, why are you drinking Pringles, girl? Like, eat a good dinner.
Yeah, right. And I know the crunches on the bottom are the best.
I said, you've got like a martini shaker, and then, you know, we're all, you know, drink water.
I know, right?
Hydrate. That's good for your median nerve.
Yeah, exactly. Essentially,
but you know, so the median nerve, right? So we say this like, oh, everyone knows what the median nerve is, but the median nerve is a combination of nerves, and it's starting in the neck, and it goes to the top of the mid back here, and so we got neck bones are called cervicals, C1, 2, 3, 4, 5, 6, 7, and then we have thoracics, which are the mid back, T1 through 12. We have C5, 6, 7. There's a C8 nerve, and then T1 as well. That's what makes the median nerve, right?
Yep.
And they talk about the pattern, which, you know, people talked about. He said, you know, here, 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 and the inside of this. And of course, what do we call those nerve patterns? We call them dermatomes.
Dermatomes, yep.
Yeah. And so that's what he's saying is those things are all coming together as a buddy and making a bigger nerve. And they do it. He said it right through here at the brachial plexus, right?
Yep.
And so you keep saying that you're making a great point. Why the heck is the median nerve ticked off? Well, it might not be right here.
Yeah, there we go. So as chiropractors, we try to evaluate the whole shebang, basically, from the entire skeletal structure, because one of the big things he said in there is not really true. So when you have your carpal tunnel, you aren't built, there's not just on this side, it's not just a block of bone, right? Inside here, and I'll show you that right now, real quick. This is there's 8 little bones that are separate from each other, And so for us, when we see multiple bones separate from each other, what does that mean? And a lot of times for us, that means there's motion in each one, right? So you have motion that can happen within each bone. So that means you have ligaments and tendons and all kinds of other stuff around that carpal tunnel. And so when you have bones that can actually move, where would you get issues, right? So that's where if you don't have the proper movement of the wrist bones in your wrist, that can be a thing, right? Now, where else could you get issues with that, Matt? What do you think?
Well, so you did great. And when can you put that picture up again? Because I think it's important to see this too. Is when we look at that picture, the 8 bones that make up the carpals, which I just pointed to my screen, that didn't help anybody. But the 8 bones that make up the carpals, look how they're all different shapes. And if we took like a 3D image, they are so uniquely shaped. There's a big fat one in the middle called the capitate, or and then we have one just closer to the arms, just below that, called the lunate. From a chiropractic standpoint, when there's a wrist issue, that's generally who we look at first. That doesn't mean he's the only culprit, but he's on the main list.
Yep.
But yeah, you can then see, as you see the 2 forearm bones, and like Jeremy was just alluding to, where can it go next? You can slip that off again, because I can't see my face. I'm an egomaniac. Yeah. Thank you.
Yeah.
But yeah, we're going to go back up, and we're going to then say the elbow. And since the median nerve is going here on the surface and it's going over the elbow, you can actually get jammed up if the elbow is misaligned, which, you and I are touching elbows all the time.
Oh my gosh.
It's such a common thing, especially with people using their mouse all the time. Obviously, athletes that had an old injury, those kind of things. Our factory folks, the people tickling people, Amy, you are correct. The ticklers.
That's nice. Well, the increase of at-home work for the last 2 years was really a sticking point.
Yeah.
As you go, but it's the mechanics of that entire structure, right? And so when we focus just into where the problem goes, that sometimes is one of our biggest mistakes, because we can have so many other mechanical issues going on, and that's where we're doing this tonight, to show you, kind of offer a different way, maybe possibly a more very conservative compared to what you just saw in that one thing, sticking a needle up your hand and wrist. That sounds real fun. But and a lot of times, one of the things that is really difficult is it's one of the most ineffective, essentially, surgeries that there is. And we know that, right?
And I appreciate what you just said, because it's less than 50% satisfactory to people that have it, but it's actually one of the most common surgeries. So even though we still, he talked about 3 different styles there, and I can't speak for every style which percentage is better.
Sure, exactly.
But the reason we have 3 different styles is because we're not getting great results.
Yeah.
But part of the reason is what we're saying right now is if we're saying there's 50% less than 50% satisfactory results, maybe they never got to the root cause. Maybe this isn't the worst of the worst.Maybe it's something else.
Right. And that's what chiropractic, we strive to look for that root cause of what's happening. And a lot of times it's the mechanics of your wrist. Many of us have had this feeling where, you pick up something in your hand. It's weird. You get something gets stuck in your wrist, or your funny bone doesn't work, and you got to like readjust your arm and then go back and lift the same thing, and it's fine, right? Those are times where the motion is not working correctly within one of those joints, right? So each of these bones that I'll show you again, each of these represents one joint, right? So there's a joint here, there's a joint where this bone is, and from your pinky into your hamate, each one represents a different place where you can have issues that the joints aren't working properly. And so what occurs is a lot of times we don't look at any of it, right? And like a lot of the things we try to strengthen, we try to do a lot of those things, which are all good. But what if we found the cause? What if one of the bones of those 8 were causing a bad motion and everything else, just like one of these Lego blocks, because I'm so proud I found this picture. If I'm building this wall, if one of these Lego blocks isn't fitting into the other one, then we would try to fix that before we can go on to the next layer, right? So that's why I always think essentially your hand is a bunch of Lego blocks that have some motion in there, but they're really locked in with like ligaments and all those kind of things. And so that's one other reason that the median nerve can be irritated or causes inflammation to happen. So that's pretty cool.
Yeah. Well, and so one thing we've kind of alluded to is, the median nerve, it starts in the neck. And of course, we're going to have a bias on this video of saying, hey, make sure we clear that out.
Yes.
He talked about the first rib. So when you feel your collarbone, and then you feel the stress muscle, which is the trapezius, there's a valley there. That's where your first rib lives, is in that valley. That's how you can access it, because it's kind of behind the collarbone, actually. And that can be an issue. It then goes past the shoulder, which can be an issue, past the elbow, through all that muscle, and of course down to the wrist. Well, we say all these parts and pieces, and you go, well, I have a numb tingle, which people come to us all the time with that. How is one way that they could kind of test on their own? Is this a numb tingle? Is it wrist related? Is it something else related? One test is a test called reverse phalanx. And the reverse phalanx is something that we're pretty aware of. It's a prayer-like posture, and what you're doing is you're putting an adorable young lady who just had an awesome birthday on your lap and saying, "Hi again, Miss Sadie."
Happy birthday.
But you're giving pressure, and they say do it for a minute. And if you do the pressure like this for a minute and hold it, frankly, if that elicits symptoms, it's most likely coming from the wrist. Is something that we can all do on our own to engage and to try to determine, rule in, rule out what could be causing this.
Right, exactly. And some of the other parts are, doing, and then there's a few different movements that you can actually determine like which bones are actually involved as well, right? So there's stuff that your chiropractor could do with us, and we can actually determine almost like, and so there's always levels of severity too. So if you hold this in a certain time frame, and then that numbness stays for a moment and then goes away, you might have the beginnings of something that's starting to happen. If it stays for longer, it's a little bit more. And then some people have the severe where it lasts for several minutes after, right? And so like even with the minute, let's say you do this or you do these and it's numb right away, and you're probably talking some type of severe thing that it might take a little bit more time to do. So that's where we wanted to talk to you guys about tonight.
Well, can I point out something? Because Megan has a great comment here.
Yeah.
And Megan up here on the screen says her hygienist wrist, which, as the son of a dentist, Megan, I love and appreciate you. Hygienists are amazing people. They get people into the dental office, which is how I ate in high school. So thank you for that. We appreciate you. But that's a great example of someone who is doing a repetitive stress thing.
Oh,
and that's from the wrist standpoint, that's the problem, right? Repetitive stress. And of course, Amy doing massage, that is a repetitive stress to the wrist. Now they teach things in school that where you're using leverage and things, we are trying not to put tons of pressure into the wrist, but what we do puts pressure into the wrist as well. But that repetitive stress, and hygiene's a great example, is what can irritate and swell the median nerve, as you started off with all this.
Yeah. So the other thing is like where, but Tom Paulette.
Oh, you can't have ants on here telling you nice things about you. You cannot have family members saying nice things about you. That doesn't count.
Yes. I mean, I'm not related to that Paulette lady.
Oh no.
That's a compliment from all kinds of. That's but
just a strange lady just saying nice things about you.
I know. I need to get her on one of these videos with us, because what we're about to go over for carpal tunnel is something similar I showed her. And now she does it, and her shoulder got a lot better. So yeah, a lot of times when you're watching, there's so much more mechanical stuff. It's more of a journey, really, with carpal tunnel, honestly, than we want it to be. And or like we we wait until it's a big problem. Can't feel our hands anymore, which is a big problem. Like it's a big problem. Like you got to use those things. And then the problem is like by that time, we've not done a ton of preventative things to see if we can actually improve it. And that's one thing we're going to go through a little bit of the different treatments that you can do on your own too. And where it starts usually, and we'll talk about this. We'll talk about it right now. But the studies say 70% of the people that suffer with carpal tunnel have weak upper body or weak shoulders and that whole shoulder girdle compared to where they need to be. Okay. And that takes away from, well, dental hygienists is a little different because their posture all day. Sometimes that's a whole different ballgame because they're constantly torqued, just kind of like a massage therapist is. But a lot of times it's that upper body strength, and there's simple ways. And I'm not talking, you got to go like Arnold Schwarzenegger. We got to just, do some stretching once we're off of the table. And Matt will tell you, we got a sweet video on here on the one, if you're watching on the YouTube, which I'll put that up there, but it's if you're not on our YouTube channel, there is a video that's called "You Want to Live Longer," and we'll kind of explain it today. But just by doing that, you would feel the strength just build right up, and that could start you on your path to getting better for carpal tunnel.
Well, and you're starting to, go back to your kinetic chain thing and where does it start? And once again, we're going to have a bias. Let's clear this out and see if the message starts getting better and the inflammation starts to go down throughout the whole nerve pathway. But as you say that, what you're alluding to, what you're talking about is, and like you said about hygiene and massage, we get jammed and stuck in this forward position and everything gets pulled tight on the front and it gets stretched out and weak in the back. Yep. And what then happens is the tightness can start to choke off that median nerve we keep talking about, which can then inflame the median nerve and start giving these symptoms we're talking about. Yep. So all these things are adding up to going, okay, we can't just focus on one thing because, this right here, great stretch for the carpal tunnel, but it's not catching all of this. So we need to make sure we're catching this as well. And that's what Jeremy is talking about, that stretch, is because that exercise, because you get a stretch and a strengthen for that postural issue.
Yep. And then a lot of times too, we could do stretches all day to our wrists, but let's say it's your elbow that's causing the problem. So if you remember back to our little video or our little graph, you see there's two big bones before the wrist that probably have some joints there that we might need to address, right? So I can't tell you how many times over the years, this is our, 20 years or something, but how many times the carpal tunnel was actually in the elbow or some kind of mechanical issue on the way to the wrist, right? So it's either the shoulder, the elbow, of course, the neck is always a thing. Neck usually is probably the number one. And then as you're going through mechanically, you start getting into the shoulders, and then the elbows are a major player, and then it gets down to those wrists. So in tonight, you all know I can talk like crazy. So I wanted to kind of show you our version of like how chiropractic would approach. I'm sorry, the giant corgi has awoken. Oh no. This is going to be bad. Okay. So anyway, so what we're going to do is I'm going to show you one of my favorite guys of all time. He's going to adjust a few parts. I think I got a wrist and elbow. I'll kind of show you that, and he'll kind of walk you through like how we adjust those different mechanical pieces in there. And then we'll come back, and then I'll see if the corgi's still going. It'll be fantastic. All right. Stay right there. All right. Let's get it to there.
And the proximal row, the triquetrum. The procedure is performed in wrist flexion, elbows out, and a direct posterior to anterior thrust is made in a single abrupt thrust once again protecting all the adjacent articulations, but leaving a void for the open area for the manipulation. I will now demonstrate the hamate at live speed. Remember,
All right, come on. Oh, come on. Oh.
pressure. When the extension maximum in a lateral position is achieved, the stabilization arm is locked to the doctor's side. Proceed with a gentle slight flexion, and the manipulation will be a medial to lateral thrust, as such.
So hopefully you like that a little bit. Did it come through okay?
Yeah.
Yeah. I was trying to give just little snippets because a lot of times those are different various adjusting protocols that there's many, many more. That was just like the one bone, the hamate bone is what he was working on there. And then the ulna. The ulna is the little elbow joint in that respect. So a lot of those are two. So a lot of times what we will do as chiropractors is just our experience with this whole thing is you have a consistent amount of adjusting that you would do to get those bones in the proper mechanics prior to the next pieces of the treatment. Now that our office too offers a lot more cool things, that's why one reason Amy's here is because we have two other therapies that help this. So one of the things the guy talked about, and I'm going to show this picture real quick. So this is that little thing you saw on the ultrasound, if you remember. You had and this is that median nerve there. It's that little red one right in there. Well, what happens is you get these tendons that start to, the ligaments and tendons that start to build up, right, with scar tissue and that kind of thing. Well, in our office, if you didn't know, there is this technique called gua sha. I should have looked it up. Dang it. And got a video of it. Next time I will. So the gua sha is a technique where we actually work with the scar tissue over the top of this area. Now, if we find the cause of your carpal tunnel is in your elbow or your shoulder, you're probably going to get that treatment in the area of the cause, right? Too. So we don't know.
Why don't we let Amy explain? How do you when you say to somebody, what is gua sha, Amy? How do you answer that question?
Well, I use some not very technical terms. Gua sha helps to smooth out fascia, which is a layer between skin and muscle. And in my head of things that I've watched, it looks like wrinkled up saran wrap. Mm-hmm. And you know how hard that is to smooth back out again. So gua sha is a tool that will help smooth that out. It will increase blood flow, decrease inflammation, scar tissue, break up scar tissue. Yeah, that's the best I can explain it.
Now, if you have gua sha on any part of your body except for Jeremy's feet, is it a comfortable or uncomfortable procedure?
Depends on the situation.
Jeremy's feet.
Listen. It's terrible. It's the worst.
Jeremy, you're lying.
It's not that bad, honestly. It's not that bad, but I tell everybody it's terrible. Then they go in and then they go, that wasn't that bad.
It's not that bad. No, it typically depends on the area and the severity, I guess, of the inflammation and pain. In majority, I'm going to say like 90% of cases, it doesn't hurt. Maybe slightly a bit of discomfort for a minute, but the almost instant tension release is pretty amazing.
Yeah. And I like that you say that because as I busted this shoulder up in high school and it flares up at times, and Amy has gotten in there and she actually enjoys getting in there because it's gritty and she likes, working out, but it's not that it hurts. I mean, you definitely have a flare to the tissue temporarily, but as soon as it's done, you're like, whoa, feel that thing. Well, that's what we're talking about, is if you've got a repetitive stress through here. I love the saran wrap analogy. That's phenomenal. It's like she's like finding that gritty. She smooths out the gritty, and now the inflammation can start to calm down. It's just a wonderful, powerful tool. It's really easy. I always, I tell people, the Chinese soup spoon. It's a nice smooth edge to it. It's just a fantastic thing.
Yeah, it's awesome. And like to add that to your treatment protocol. Now with chiropractic, you're going to understand you're going to live there for a while. These are chronic injuries that happen over time. So a lot of times what I showed you with Dr. Malley doing an adjustment on there, that's one time. We have to keep that mechanical going. We got to keep the gua sha kind of improving it. Yeah. So that's the spoon I'm scared of, people. Right there. I'm like petrified.
Jeremy is frightened of
I'll tell you this. It fixed my plantar fascia really, really good. But I'm massively ticklish on my feet, and the pain of it. It was not fun. It was like, but the rest of my body, like, it's not even an issue. Like, but I don't know what that combination of tickling and your feet are hilariously dying of, like, it didn't make any sense to my brain. I think
just know you're not our best salesman for gua sha.
No,
okay?
Just not for gua sha, but there's so many that do it. It's amazing. And then the other piece to it, as a grouping, let's say somebody comes in with like just starting carpal tunnel, let's say, so they're not having it all the time. Maybe it's the same grouping. It's just how long are you in for, right? So you might be in treatment for a longer period of time. And so this other thing we have is cold laser therapy. And so, what did Matan? Yes, Matan Paulette is going to be used anywhere on the body, and that is correct. Yeah, you can absolutely do that.
Yeah, cool. Just imagine anywhere you can. Hey, that was cool. You put that on the screen. I like that.
Yeah, isn't that cool?
But yeah, it's just imagine anywhere that you can injure, you can gua sha. That's really another way to think of it as well too. Yep. It's getting in there and it's breaking up old injuries is how I like to describe it as well. So
yeah, and that is a major one. And then so now that we have those tools, and then we have this one called cold laser, which Matt has a better explanation than I do, so I'm going to let him take it away on the laser, because it's very cool. I'd say internal heat, like a deep internal heat that starts the initiation of like healing again. So it's such a good combination with a gua sha, and that kind of thing. So
yeah, and I always like to clarify, when we use the phrase cold laser, it's not physically cold. There's really two broad categories of laser. There's a hot laser, which is a cutting laser, which they do for surgeries and stuff like that.
Right.
But then there's a cold laser, which is a healing side laser. And so that's why it's called cold laser. But if you stopped moving the laser, you didn't keep moving it around, you'll feel heat real quick. Yeah. And I presume you'd probably burn yourself, but I've never attempted to do that. So I don't feel like I want to find out. But
maybe I have, maybe I haven't.
But the way I describe laser to people is laser speeds up the healing process. And what it does is whenever there's an injury, your body goes into an inflammatory process. And it's kind of like if you've ever listened to a YouTube video, you hit it at 1.5 times instead of just 1 time normal speed. Sorry, honey. If you hit it at 1.5 times, you're still listening to the YouTube video, but now you're listening to 1.5 times faster than its normal speed. Or if you got a DVR and you hit the 2 times button or whatever, that's what cold laser is doing. And it penetrates deeper. So there's only so much effect you can get from ice or even surface heat. But cold laser is just getting to the deep nitty gritty. And not that the wrist is super thick in this case, but like in a case of a shoulder or something, you can have some deep, nasty stuff down there that it can get into and actually start the healing process, speed up the healing process. And that's really what laser's doing. It's just kind of hitting the fast forward button of the already existing healing process. And we're talking about a repetitive stress chronic injury. Well, we break things up with our gua sha. Well, first and foremost, we clear the spine, make sure everything's fine there. We clear out the extremities, the joints, but then we break up the old injury with the gua sha, and then we heal the deep injury with the laser. My goodness gracious. for so many people, that is going to be the total package.
Yep. And that's basically, it comes down to consistency on carpal tunnel, because it was consistently hurt for so many time frames, right? That it takes consistent care to get back to that. And that's one of the hardest parts, you know, in choosing a holistic pathway, right? A holistic pathway is going to take you time. That's where surgery beats us all the time. They have, you're out of surgery in a day, right? But the problem is like, at what cost? And when you have such a surgery that goes in, and you saw it in the beginning of this thing, of like what that would entail, what could happen if you go into and have this thing cut, you know, any kind of incision? What did he say that all of us should be like, wait, aren't we trying to get rid of the scar tissue, but we just cut it and we're going to make more scar tissue in the same exact area, right? And so that's one of the big falters of not looking at the mechanics of the wrist itself, right? Instead of, or I'm sorry, the mechanics of everything, and trying to get rid of that scar tissue so it's working with your body, right?
Well, and just to put that in perspective is, you know, so we're talking about the median nerve, you know, going through a tunnel, right? Carpal tunnel. And we start putting scar tissue in there, and it makes that tunnel smaller. And so it's even more propensity, more likely to get irritate the median nerve, because the scar tissue is making the tunnel even smaller.
Right.
And so there, you know, and there's people that, and we all, well, we know, you other people would likely know people that have had multiple carpal tunnel surgeries, frankly, with, you know, minimal effect. I mean, why would they had multiple on the same wrist? It's because they haven't gotten the result they want. Now, of course, I say that, and people have had some carpal tunnel surgeries and gone, oh my gosh, brand new world, life is great, and ecstatic for that. We're not saying those people are wrong. We're just going, hey, here's some other thoughts and ideas if you're looking for options before you get there. But, and while I appreciate, you know, like you said, surgery can be, you're gone in a day. You probably went through PT 2-3 times a week for 6 to 8 weeks.
Correct.
All that time, all that money. You've probably done a lot of things before you even get to that point. You might have done shots. They do corticosteroid shots in the wrist. You've done all these different things. And while it took time to get that way, and it takes time to get better, what are we going to say? 3-4 visits, you're going to see you maybe won't be a complete healing, but you're going to clearly know if this is helping or not, right?
Right.
It's not like we're talking 30. We're talking 3-4.
Exactly. Yeah, it's kind of one of those things where you could step as we improve. So once you do it, you start feeling that improvement pretty quickly. And then once you start feeling that, we know, you know, like where your overall result will probably be, you know. And so, and you know, that if we're not finding any changes, the beauty of the chiropractic that I love is we'll try to make sure that is the why, right? There might be some other actual issues that might be going on. I'm not going to do the same thing, trying to get the same result. We're going to start breaking down. Okay, maybe we thought it was your wrist and it wasn't. It ended up being your elbow or your shoulder, your neck. You know, all these different things could contribute, but as we go, we constantly are moving and learning as you go. Cause that's the biggest key to this whole thing, and all the holistic is we got to learn it, you know, and you have an opportunity to do that. And really after a surgery, you really don't have that opportunity. And that's the problem, you know, like after it's done, but you can still get things done to and that's another good point. People that have had failed carpal tunnel surgeries, they can still get their wrist adjusted and all those kind of things as well. So that's something you don't have to like shy away from either if you had one already, which is very common. So I know lots of people that'll be watching this have had surgery already. You know, my record for one of my guys is 5 on each hand. So he was a truck driver. Yeah, 5 on each hand. And it's tough because it's one of those things where, you know, once you go down there, we got a lot of work to do to get that back, you know. And so this is just a way, I think, a fun way too, I promise you, those adjustments to your wrist, you will love me anyway because it feels great. And so, it's not a scary one or anything. But as you go, once you start getting that done, you're like, whoa, that feels amazing. So one day I'll have our buddy Tony, who's kind of a pain. I'll probably see him tomorrow. He's a patient of ours. I won't leave. But he's one of my favorite stories on just wrist stuff. He is a guitar player that couldn't bend his up. So he couldn't do wrist like up 90 or this way, right? So he couldn't do either one of those directions very well. He was about like that. So anytime he tried to play his guitar, he had to come like this way. And so just for giggles, as we're studying this stuff, I was like, how about I just don't let me forget. We're going to adjust your wrist every time you're in, right? And so he'd always get his back adjusted and all that stuff. But then we just started doing that, even though we knew we could do more, with the gouache and laser and all those kind of things too. But he didn't have pain or anything. I just wanted to see if I could get that motion back. And sure as nothing, we adjust his wrist every time now. And then it's just so much more flexible. And so that's the stuff I want you to think about, especially if you're starting to get a little numb, it's not a bad question to ask, and I think, we're going to hit that. Oh, we're doing good. Like 10 minutes. Super proud of myself. Yes. All right. Let's see. Do we have anything else to go over?
Amy had the hook. I think she was trying to reach through the screen. And
yes, I think we're good. But yeah, so if you guys have any other questions, thank you for hanging out with us. Yes. We so appreciate it. Hopefully it came out good. We're using a little software that's different. We love it on this end. Mm-hmm. We'll just make sure that it's good on the other end. And we'll be doing one of these once a month on different topics.
Would love input. We obviously have a million topics that we're passionate about, but obviously what others are passionate about is what we're really passionate about, and
exactly.
We can talk on 5 million things, but that doesn't matter if you guys don't care about the topic. Let's hear what you guys want.
Yep. And that's what we'd like to do. So as you hear this as even as a replay, stick it in there because we're going to be, checking out every time. So if you see this later and you weren't here for the live, that's fine. Put your topic in that chat, right? And then we'll be able to catch that because some of these topics people want to hear, but we just don't know because we're in our office, not paying attention to all that, out there as much. So man, I appreciate you guys. Let's see if I got any. I'll have some cooler themes out there. I just like the new background stuff. Oh, that one fits better.
Yeah, that definitely fits your personality.
For sure.
I do feel like that's what's going through my head.
There we go. Very flowery.
Oh boy.
I love it. I love you guys. You guys take care, and we'll see you next time. Next month, we'll have something. Yes. So watch for it. Take it easy.
Boy.
See you later.